I'm supposed to be seeing Dr. David Goodman.
Okay.
But I'm just going to give him a try. There's actually another surgeon I want to see in Chapel Hill.
Okay.
And so I don't know if I need a referral, if I can make that appointment myself.
If you need a referral, let me know.
Okay.
Why? Just out of curiosity, why are you interested in going to Chapel Hill?
Well, Dr. Felice was my original surgeon. She can't
Right.
do surgeries anymore, so I wanted
Right.
to see what my options were.
Okay.
And I had a friend that went up there, and she liked the surgeon that she had up there.
You know the surgeon's name?
I don't know. I'll have to look it up. It's in my messenger.
Okay. There's some really good surgeons there. Dr. Goodman's a good surgeon as well. But the truth is, so you had left breast cancer in 2015, and now this new problem is in the left breast again.
Yes.
You're going to need a mastectomy.
Yeah.
I mean, and so the only question is, do you get reconstruction? Do you just do a mastectomy? What are your choices for that? Because you're going to lose the breast. And so
Yeah, I kind of figured that they said I can't do radiation again. Yeah.
Right.
Now, do I only have to have the one done, or can I get them both done?
You only need the one done, but for some women having gone through this twice, they really want the other one done too. And that's something to talk to your surgeons about.
Okay.
Because if you just don't want to have to worry about a third time,
then
that's not an unreasonable discussion to have.
Yeah, because there's a really big tumor on this side. I know it's benign.
But that one was benign. But yeah,
it's getting bigger.
You feel a lump in there that's getting bigger, and I mean, I said, heck, having gone through this twice.
Yeah.
How many times do you want to go through biopsies for them to say, well, it's benign, but it's getting bigger, and before it starts bothering you, or it hides something new. So.
Yeah, because this one is quite large. You can feel it. It's big.
Oh yeah.
It's big.
That's good. Good size. Now, is this where they did the biopsy right there?
Yeah. Okay. And it wasn't that big before, because before I couldn't feel it that well.
Sometimes when they do the biopsy, it bleeds a little bit.
Well, it bled
so
a lot.
a lot of times things will feel a lot bigger after a biopsy. I see that a lot.
Okay. Because I noticed that. I was like, had my husband look at it too.
Okay. So you're going to see Dr. Goodman on Thursday? Is that 2 days from now?
Yes.
Okay. You say your chest hurts. Where does your chest hurt?
Usually it's in the breast area.
Okay.
Like on my left side, it's like right in here.
That doesn't surprise me too much. A lot of women who've been through breast cancer treatments have breast pain. I hear that a lot. But for you, the real question is, what's really going on? And we know there's cancer back.
Yes.
You're going to lose the breast. The next question is really going to be, do we need to do anything after that?
Yeah.
Knowing that you had your chemotherapy about a year ago, I would really have to think hard about the details. And it would be in the details of what shows up. Unless I'm really surprised, I would lean towards probably not.
Okay.
But depends on the details. And so I think that for you, the next step is see the surgeon, get that part done. If you're interested in both sides, talk to the surgeon about that. If you want to go to Chapel Hill and you need a referral, let me know. I'll be happy to make that for you if you need it.
Okay.
But then after your surgery, when we know exactly what's there and all the details of it, I want to see you back so we can talk and decide then. Ultimately, the decision is yours. I mean, I can say, here's what I recommend.
Yeah.
You can tell me to take a fly and leap off the roof for all. I mean, that it is your health and your body.
Yeah.
But I want to see the results before we say, here's what we're really dealing with. Is this a recurrence of what you had before? Is this something totally new? Is this something that's really scary or not very scary at all? And so it's in details.
Okay, so the type of cancer I have right now, you don't know until they do the mastectomy?
Right.
Gotcha.
Well, the biopsy says it's invasive cancer.
Okay.
But I want to see exactly how big, exactly how extensive. Is it close? Is it not close? I mean, let's put the details together.
Okay, so what exactly does invasive mean? Just that is like breaking out of
There are two kinds of breast cancer.
Mm-hmm.
If breast cancer starts in the milk ducts, okay? If the cancer grows inside the ducts, and it can get bigger, but it stretches the duct out, but it stays inside the ducts, that's what we call carcinoma in situ, DCIS.
Yeah. Okay.
Because it hasn't broken through. Invasive means that it's growing out through the walls and into the other breast tissue.
Gotcha.
So it's invading past the ducts into the rest of the breast. The distinction is there because if it's inside the ducts, it can get bigger, but it doesn't spread to lymph nodes or bones or lung or anything like that.
So it won't metastasize.
It won't metastasize. If it's invasive, then not only can it grow into the breast, but that's when it can metastasize.
So we don't know if it metastasized yet either.
We don't know. I know your breast cancer from before was invasive.
Yeah.
I know that this one is invasive.
But we don't know to what extent.
We don't know to what extent.
Gotcha.
Surgery. All right? So you need surgery. Dr. Goodman's a good guy, but if you want to go to Chapel Hill, you let me know. I want to see you back here a couple weeks after your surgery.
Okay.
I don't know when your surgery is going to be. A couple of weeks after your surgery, because by then we can get all the details and put them together and make plans. Because the question is really going to be, we got to make plans. Are we going to say we're just going to watch? Are we going to do scans? Are we going to? Doesn't matter. We won't know that until we see what's there.
Okay.
Okay.
Yep. Well, I'd already figured that I'll have to have the mastectomy because it's on the same breast
And that
can't do radiation.
That's the key point. You've had radiation. We can't do it again. So just a lumpectomy is not enough. And if it's really looks like the same cancer as before, then that means that the chemotherapy and radiation didn't control it before. So, I mean, I would tend to say if it looks like the same thing, I probably wouldn't recommend more of the same. I mean,
Yeah.
if it was 5 years ago, it'd be different. But it was a year ago. So,
Yeah.
but it's details, and we got to get the details.
Okay.
So, see Dr. Goodman. If you need a referral to Chapel Hill, name the surgeon. I'll be happy to make it to you. I know some good surgeons up there. Dr. Gallagher is a really good lady surgeon who does good breast cancer work. But, I mean, I work with all the people up there enough that if you need a referral, you just let me know.
Okay, I appreciate it. Thank you very much.
If you